It's Professor Marcus. I want to take a few minutes of your time to talk about diabetes and some complications that can happen with diabetes. First, let's define diabetes. ATI informs us diabetes mellitus type 1 is an autoimmune dysfunction, and this involves the destruction of the beta cells which produce insulin in the islets of Langerhans of the pancreas. Diabetes type 2 is defined as a progressive condition, and many times it's called insulin resistance. And in this case, it's related to decreased production of beta cells. Interestingly, diabetes is more prevalent in African Americans, American Indian, and Hispanic population. Also, males more than females. Risk factors include high blood pressure, hypertension, hyperlipidemia or high cholesterol, sedentary lifestyle, and gestational problems of infants weighing more than 9 pounds. ATI also wants you to know what metabolic syndrome is. And this is a situation with a trunctal belly and where patients have sedentary lifestyles again with high blood pressure, elevated lipids, and triglycerides. And these are precursor to diabetes. What is the premier test now to check if a patient has diabetes? Obviously they present with symptoms, but also the test that's used is the A1C, glycosylated hemoglobin. And ATI wants you to know expected ranges are 4 to 6%. And acceptable ranges are 6.6 to 8% with a target of 7%. What's interesting about the A1C is it does a mean and average of the last 120 days in the bloodstream of sugars. So we can really tell if a patient's been compliant or non-compliant or how brittle they are. Another test we do is the ketones in the urine. And any ketone level greater than 300 mg per dl is also a Geiger for diabetes. Obviously, you'll be doing many finger sticks in your practice, and this is another blood glucose levels that are done with the finger many times before meals and at bedtime. Let's talk about diet and diabetes. Patient is diagnosed with diabetes. So you as a nurse, when do radical education with balanced diet. ATI says carbohydrates should be 45%. Protein 15 to 20%, unsaturated and polyunsaturated fats 20 to 35%, and they also mention omega-3 fatty acids, and they're found in fish, and they have an amazing ability to block inflammation and help with the glucose uptake. So what happens when we eat? We break down the food from the bolus and we start digesting. The glucose and carbohydrates go into the bloodstream. The pancreas produces the hormone insulin. Here they use it as a key, as a lock, to go into the cell and therefore deliver the glucose that the body needs. Well, what happens if that doesn't happen? The body starts looking for other resources. Remember, the body is all about survival. So first we have high blood sugar, hyperglycemia, polyuria, polydipsia, excessive thirst and excessive urination, and polyphagia, hunger. The hunger is caused by the inability of the cells to receive glucose because of a lack of insulin or cellular resistance to the available insulin. We have metabolic acidosis that happens, and this is coming from the ketones. Remember, the body is reaching for something else, so it goes to the ketones. They have fruity breath, these patients. They have an unusual breathing called Kuzma, waxing and waning. And this is due to the body's attempt to excrete carbon dioxide and acid due to metabolic acidosis. Many times they can have seizure. The Kuzma, very recognizable when you see it. So diabetic ketoacidosis is diagnosed with blood sugar greater than 300 mg per dl, and the body reacts by breaking down body fat for energy, and this causes dehydration, metabolic acidosis, and accumulation of ketones. It's a rapid onset, 10% mortality. Let's move on to looking at another condition with very high blood sugars, and that's hyperglycemic hyperosmolar state, HHS. And we're going to do a comparison here of what each of them are to each other as far as recognizing and understanding the difference. So, diabetic ketoacidosis, more prevalent in type 1 diabetes. HHS, type 2. What's interesting is this, they both can be life-threatening, but the mortality is much higher with HHS. Look at some of the other idiosyncrasies. Onset is longer. The prodromal period is shorter, and mortality is higher, as I mentioned, and the age is also a higher age patient. We want to talk about oral hypoglycemics, particularly metformin. Metformin is mentioned many times in proctored exams and NCLEX because metformin and dye. Stop medication 48 hours, metformin, before any type of radiographic test with iodine contrast. And because this protects the kidneys, this combination is too much many times for patients with poor BUN. Let's talk about HHS and some precursors. A client with type 2 diabetes who had a heart attack, an MI, he's at risk for HHS, or she is, secondary to increased hormone production. A client who has type 2 diabetes is at risk for HHS when the BUN is greater than 35 mgs for DL. The kidneys can't filter the glucose. Glucose is a heavy molecule. A calcium channel blocker can increase the risk for HHS for type 2 diabetes and in general the older population. So what about labs for glucose level? We talked about A1C, but blood glucose levels greater than 200 mgs for DL, irregardless of the last meal, is a diagnosis for diabetes. Fasting blood sugars greater than 126, and as we mentioned, the A1C greater than 6.5. What do we do if someone comes in with diabetic ketoacidosis? Many times we give them isotonic IV fluids and obviously insulin for either one of these conditions. So let's talk about your role. You as a nurse, patient has been diagnosed with diabetes, comes into the hospital, is overwrought that they have this diagnosis. What can you do to help them? You may help them embrace this lifestyle. Make sure they keep a diary of their blood sugar. Make sure they understand signs and symptoms, hyper and hypoglycemia. Make sure at bedtime they always take a snack for insulin so they don't have insulin reaction while they sleep and go into comas. Make sure that they understand if they don't embrace this life, they can have organ failure, they can have retinopathy problems, and they can have neuropathy. You as a nurse can be integral in helping them through this, and as I said, having healthier lives, understanding that exercise is important, but when they exercise, they also have to put that into the formula to know that their insulin and their sugar needs to be adjusted. Basically, that's in a nutshell. Thank you for your time.